Olivia's overwhelming medical journey begins. Olivia had always been a dreamer, her childhood spent in imaginary games where she was the only doctor saving everyone in her small town, and that childhood dream only solidified over the years, transforming into a deep, unwavering desire to wear that same white coat, a symbol of hope and knowledge, which she had seen in the medical encyclopedias she devoured as a teenager. Even though she didn't understand half of the complex terms, but sensed their gravity. She was the first in her family to pursue medicine, and this brought both immense pride and enormous pressure, as all eyes were on her, expecting brilliant success from the future doctor, a title she earned even before she stepped foot into the university. When the acceptance letter to the prestigious East Coast Med School finally arrived, it was a moment of euphoria that quickly transitioned into deep anxiety, as she realized the dream had now become a colossal amount of work, and her first battle wouldn't be with diseases, but with the language in which those diseases were described. The first day of med school was a genuine shock for Olivia. The lecture hall was packed with incredibly smart students who seemed to already know all the textbooks by heart, and the lectures felt like a high-speed language course, where the professor spoke so rapidly, using such dense, academic English, that Olivia could physically feel her brain struggling to process the information. She knew general English. She could hold everyday conversations, but this medical terminology was an entirely foreign language to her, filled with Greek and Latin roots that had no connection to the common English words she had learned in school. In the very first anatomy lecture, the professor, who seemed the embodiment of stern academic perfection, began listing parts of the body using words like gastrocnemius, deltoid, and sternocleidomastoid, and in that moment, Olivia felt her newfound confidence begin to crumble. She tried to take quick notes, but her hand froze over the page because she didn't know how to correctly spell these long, confusing terms, and when she later tried to look them up in a dictionary, even the correct spelling proved to be a separate, difficult task. Next came the physiology lectures, where she encountered concepts such as homeostasis and cellular respiration, which were challenging to understand even in one's native language, but in English they sounded even more tangled and abstract. Olivia spent her evenings in the library, attempting to translate every third word in her textbooks, a method that was disastrously inefficient, as it took her 3 times longer than her peers to get through a single chapter, and she constantly felt like she was falling behind, lagging. Her greatest fear was that she wouldn't be able to pass her diagnosis exams, as accurate diagnosis required not only knowledge of pathologies but also an instant, confident command of terminology to precisely describe symptoms and the prognosis. As the first major test approached, Olivia began to panic. She could grasp the gist of a sentence but couldn't distinguish the key terms that differentiated, for example, hypotension from hypertension, low blood pressure from high blood pressure, and that small linguistic error could potentially cost a patient their life in a real-world scenario. She felt isolated because most of her classmates were native speakers, and they naturally picked up all the abbreviations and slang used by doctors, while Olivia constantly had to ask for clarification and felt lost in translation, confused. This was the toughest period of Olivia's life, where her dream of the white coat had turned into a daily struggle with a language barrier that she hoped to overcome with sheer hard work, but for now, that work was not yielding the desired results, and her confidence and motivation were slowly fading under the weight of thousands of new, incomprehensible words. This relentless academic pressure and the constant need to process complex information in a language that felt foreign were exhausting, making her doubt whether she truly belonged in the demanding world of medicine, where split-second clear communication was paramount, forcing her to consider if her language skills were a permanent obstacle to her professional ambitions. A wake-up call for change. The first major exam day arrived, a swirling mix of fear and adrenaline filling the massive lecture hall where Olivia and her classmates sat poised to demonstrate their mastery of the initial medical sciences, and despite weeks of relentless, isolated studying where she pored over every page of the anatomy and physiology textbooks, Constantly flipping between the text and a dictionary, she felt utterly unprepared, realizing that recognizing a word on a page was vastly different from recalling it instantly under the pressure of a timed test designed to weed out the weak. When the paper was placed in front of her, it was like a foreign code. The multiple-choice questions demanded not just recall, but rapid comprehension of complex clinical vignettes using dense medical English, forcing her to differentiate between subtly described symptoms and potential pathologies that hinged on knowing the exact definition of a single root word. She stumbled immediately on a question involving the digestive system, where the options included terms like gastritis and enteritis, and because she hadn't yet grasped the consistent meaning of the gastro- and entero- roots, she was forced to guess, a moment that felt less like an academic decision and more like a desperate throw of the dice. 2 weeks later, the results were posted online, and Olivia's fingers trembled as she logged into the system, her heart sinking immediately when she saw the bright red F displayed next to her score, a failing grade that was not only personally devastating but felt like a public declaration of her inadequacy in a highly competitive environment of med school. This failure was more than just a bad mark. It was a profound blow to her self-esteem, confirming her deepest fear that the language barrier was not just a minor hurdle, but a colossal, career-ending obstacle, making her question if she truly had the capacity to succeed in American medicine where communication and precise use of terms were non-negotiable professional necessities. She spent the next few days in a fog, retreating to her room and avoiding the common areas, too ashamed to face her peers who had undoubtedly passed, allowing the feeling of being lost in translation to consume her, wondering how she could possibly catch up when the pace of the curriculum only accelerated, with the next unit already moving into the complexities of cardiology, the study of the heart, and pulmonology, the study of the lungs. It was during a tearful late-night phone call with her parents that she had her initial glimmer of clarity, realizing that self-pity wouldn't change her score. Only a completely new, radical approach to language learning would save her dream, understanding that she was failing not because of a lack of intelligence, but because her study strategy was inherently flawed, focusing on individual word translation rather than structural understanding of the medical lexicon. She decided then and there that she needed to stop treating medical English as an impossible obstacle and start treating it as a code that could be broken, acknowledging that every long, scary term, like pericarditis, inflammation of the tissue surrounding the heart, was actually composed of smaller, repeatable components that held the key to instant comprehension. This realization was the first step away from isolation and despair. She decided to embrace the challenge head-on, transitioning from merely reading the language to actively deconstructing it, setting the stage for the crucial shift in her learning method that would eventually lead to her highly anticipated aha moment, marking the true beginning of her journey toward becoming a competent and confident doctor. The discovery of ancient roots. Following the devastating failure of her first major exam, Olivia realized with painful clarity that the traditional, exhausting method of simply reading and rereading entire chapters and attempting to memorize thousands of individual, lengthy words like cholecystitis, inflammation of the gallbladder, or laryngoscopy, visual examination of the larynx, was fundamentally flawed. A self-sabotaging approach that treated the vast medical lexicon as a collection of random, isolated entities, rather than the structured, logical system it truly was, rooted deeply in ancient Greek and Latin, a heritage that ironically held the very key to her academic freedom. She closed the heavy textbooks for a full day, not in surrender, but in strategic withdrawal, deciding to spend that time thinking like a linguist rather than a passive student, determined to find the underlying structure that her native-speaking peers seemed to intuitively grasp without effort. Her breakthrough began not in a lecture hall, but in the dusty, neglected section of the medical library dedicated to the etymology of medical terms, where she discovered that an astounding 90% of all specialized medical vocabulary could be understood by breaking them down into just 3 consistent components: a prefix, at the beginning, often indicating location or time, a root, the core meaning, typically a body part, and a suffix, at the end, usually describing a condition, process, or procedure. This profound discovery was the turning point. It was the first strong crack in the impenetrable wall of language that had been blocking her progress, giving her an immediate, actionable strategy to replace her previous, futile efforts. Olivia immediately abandoned her old, messy notebooks filled with translated paragraphs and started a dedicated, highly organized, medical code breaker journal, dividing each page into 3 columns labeled prefix, root, and suffix, systematically listing and defining the most common components, such as cardio-, meaning heart, nephro-, meaning kidney, hema-, meaning blood, ectomy, meaning surgical removal, and pathy, meaning disease. She then transformed her studying routine, creating hundreds of specialized flashcards, but instead of putting one entire complex term on each card, she dedicated them to the individual components, practicing combining them like building blocks. For example, she would hold up the root card, nephro, and the suffix card, ectomy, and immediately recognize and verbalize the meaning nephrectomy, surgical removal of the kidney. This method provided an immediate, quantifiable improvement in her ability to instantly comprehend new words. Instead of encountering gastroenteritis and seeing 6 random, confusing syllables, she saw gastro-, stomach, plus entero-, intestine, plus itis, inflammation, and the meaning, inflammation of the stomach and intestines, instantly clicked into place. This was her true aha moment, realizing the language was structured, not random. However, she knew that conceptual understanding wasn't enough. She needed to master the speed and fluency of spoken medical English, especially the rapid-fire conversations that occur during clinical rounds. Therefore, she proactively sought out study groups composed primarily of native English speakers, a daunting step that initially brought back feelings of insecurity, but she pushed through the fear, deliberately putting herself in situations where she had to explain complex conditions like myocardial infarction, a heart attack, out loud, forcing her brain to retrieve and articulate the correct English terms under the pressure of real-time communication. This practice was brutal but essential. In these groups, she also began to absorb the casual medical slang and abbreviations, learning that doctors often say stat immediately or refer to an X-ray as a film, or that PRN means as needed, knowledge that was never taught in a textbook but was crucial for effective teamwork in a hospital setting. The combination of her strategic, root-based vocabulary mastery and her focused verbal practice in study groups began to bridge the gap between her intellectual knowledge and her functional language fluency, preparing her not just for the next exam, but for the actual demands of working in a busy American hospital where clear, quick medical English saves lives. Applying the linguistic strategy. With her new, rigorous linguistic strategy firmly in place, Olivia approached the rest of her second semester with a fundamentally different mindset, no longer viewing the enormous workload as an endless vocabulary list to be memorized, but as a series of intricate puzzles waiting to be solved using the Greek and Latin keys she had painstakingly collected in her medical code breaker journal. And this shift transformed the overwhelming anxiety of learning into a focused, almost playful, academic challenge. The difference in her performance was immediate and dramatic. During the next major test focusing on cardiology, the study of the heart, and nephrology, the study of the kidneys, where complex terms like glomerulonephritis, inflammation of kidney filters, were common, Olivia didn't need to panic, as she instantly recognized glomerulo- little filter, nephro- kidney, and itis, inflammation, allowing her to deduce the entire meaning of the condition faster than many of her native speaking colleagues who relied solely on rote memory. She consistently scored significantly higher, not just passing, but excelling in the subjects that had previously brought her to the brink of giving up, demonstrating a depth of conceptual understanding that impressed her professors, who noted the sudden and remarkable improvement in her ability to articulate complicated treatment plans and differential diagnoses with precision. This academic success fueled her growing confidence, which became crucial as she entered her initial clinical rotations, where the theoretical world of textbooks collided with the high-stakes, fast-paced reality of the hospital environment, demanding instant and clear communication with nurses, residents, and most importantly, anxious patients. Her first rotation in the emergency room, ER, was particularly intense. Here, medical English was spoken at maximum speed, often clipped with abbreviations, and filled with urgent imperatives, forcing Olivia to rely heavily on her practice in the study groups to keep up with the rapid-fire patient handoffs and critical updates. She faced a pivotal moment when a patient arrived with severe chest pain, and the attending physician quickly dictated a series of orders: get an EKG stat and prep for possible intubation, and while a few months ago she might have frozen, consumed by the unfamiliar terms, she instantly understood that stat meant immediately and understood that intubation was the procedure for placing a breathing tube, allowing her to react quickly and professionally, retrieving the necessary equipment without delay. This was the true test of her language mastery, the ability to perform life-saving actions based on instantly processed, spoken English. Olivia discovered that her initial struggle with the language had actually given her a unique advantage. Because she had been forced to dissect every single term at its root level, her understanding of the precise meaning of words like hypovolemia, low blood volume, or tachycardia, fast heart rate, was often deeper and more accurate than those who had simply absorbed the words without analyzing their construction. She became known among the residents for her meticulous charting and for her exceptional bedside manner, often taking extra time to explain a chronic condition to a worried patient, skillfully translating the complex, technical language of medicine, like hypertension, into accessible, reassuring lay terms, high blood pressure, bridging the communication gap that often exists between medical professionals and the public, showcasing both her technical command of English and her deep empathy. This ability to fluidly switch between highly technical terminology and simple, compassionate speech proved that her persistence and strategic linguistic approach had not only saved her academic career but had fundamentally shaped her into a better, more thoughtful doctor, capable of serving a diverse American patient population effectively, cementing her belief that every struggle is an opportunity for profound structural growth, transforming a previous weakness into an undeniable professional strength. Persistence transforms obstacles to triumph. Years passed quickly, filled with intense residency rotations, rigorous licensing exams like the USMLE that tested not just her medical knowledge but her sustained ability to process and articulate complex clinical scenarios under tremendous time constraints, and the countless hours spent refining her communication skills in high-pressure environments. A testament to the fundamental change in her approach that began with her realization about the structure of medical language. Olivia's initial struggles with terminology and academic English faded into a distant memory, replaced by the effortless fluency and professional command that characterized her interactions with colleagues and patients alike. But she never forgot the crushing feeling of failure from her first exam, using it instead as a motivational anchor to maintain her commitment to clarity and precision in her work, always ensuring she could explain a diagnosis or a treatment plan in the simplest terms for her patients. After successfully completing her residency in internal medicine, Olivia achieved her lifelong goal, accepting a position as an attending physician in a busy metropolitan hospital, the very place where she had faced some of her most challenging language hurdles during her rotations, and now she walked the halls in her pristine white coat, carrying the weight of responsibility with confidence and grace. She excelled particularly in her ability to manage complex cases involving multiple chronic conditions, such as a patient with both type 2 diabetes and cardiovascular disease, where the management of medications and lifestyle changes required incredibly detailed, yet accessible communication to ensure patient adherence and understanding, a skill she developed through her focused practice on translating technical jargon into plain English. Her colleagues frequently commented on her exceptional bedside manner, often noting how she could quickly build rapport with diverse patient populations, attributed in part to her sensitivity to language barriers and her dedication to speaking clearly and avoiding unnecessary medical slang unless communicating directly with other specialists. One day, a young medical student, looking visibly stressed and overwhelmed, approached Olivia in the cafeteria, confiding in her about the sheer impossibility of mastering the specialized language, specifically mentioning how terms in neurology, like synaptic cleft or dendrites, made her feel like she was learning Martian, perfectly echoing Olivia's own feelings from years prior. This moment provided Olivia with a full-circle perspective, prompting her to share her own story. The fear, the failing grade, and the profound strategic shift that followed, emphasizing that the key wasn't simply to spend more hours studying, but to treat medical English as a code built from prefixes, roots, and suffixes, encouraging the student to stop translating and start deconstructing the words into their ancient components. She explained how mastering the meaning of simple roots like pneumo-lung/air or ophthalmo-I instantly unlocked dozens of new terms, transforming the study process from painful memorization into a logical assembly exercise. Olivia continued to mentor the student, stressing the importance of persistence and active communication, urging her to join study groups and practice explaining concepts out loud, reinforcing the lesson that fluency is achieved not just by reading but by speaking and applying the language in real-time professional contexts. Olivia's success became a silent testament to the idea that initial struggle does not define ultimate outcome. Her aha moment, which initially felt like a small, personal breakthrough in a dimly lit library, had scaled up to become the foundational strength of her entire medical career, allowing her to confidently perform critical tasks like ordering an X-ray or explaining a complicated surgical procedure to a family member. She often reflected that the language barrier, the very thing she feared would end her dream, ultimately forced her to learn medicine with a unique depth and structural understanding that her peers had missed, making her a more meticulous, empathetic, and ultimately, a more effective doctor. She realized that learning the specialized language of medicine, which once seemed like an insurmountable obstacle, had actually been the greatest, most rewarding challenge of her life, proving that effort combined with the right strategy can transform any language learner into a master of their desired field. Her journey sends a powerful message to all students of English. Don't be afraid of the complex words. Break them down, understand their structure, be persistent, and you will not only achieve your dreams, but you will also become stronger because of the struggle.